As one of my bosses used to say back in the day, we are late, but it will be great. Yes, it does promise to be great. Now, Report Desk Africa, as we mentioned earlier, if you're just joining us, is where we take you through some of the stories that have made the headlines across or in the past week across the continent, and sometimes we go way beyond the past week. Well, we would first give you some of what we call, will I say, headlines from what we're expecting in this week. We look into our crystal ball and predict some of the stories that will make headlines in the week. And last week, this was what we were looking at. Now, for last week, we told you that the Democratic Republic of Congo, the president there, Federick, has called for a speedier withdrawal of United Nations forces in his country to begin this year.
And we also told you that Morocco is set to spend $12 billion on earthquake recovery. And finally, we mentioned that the UNHCR, WHO sounds alarm as Sudan crisis claims hundreds of lives, especially those of children, and it claims them to malnutrition and measles. This is a very sad story and a sad development that we're still monitoring in Sudan. Well, like we said, this is Report Desk Africa, and in the meantime, we will go straight to the topics that we have for you for today. Now, on average, more than 43% of the population practices open defecation, as stated in the Namibia census mapping basic report of 2019 to 2021. Citizens who do not have access to basic facilities like toilets make use of dump sites, riverbeds, and plastic bags to dump their feces. Despite all the investment and upliftment of informal communities, some 23% of those living in urban areas still defecate in the open. In the rural areas, the statistics explode to a shocking 65%. Proper sanitation keeps water and food free from contamination, children in school and people healthy and safe from danger, but attempts to provide adequate sanitation is yet to yield significant results in Namibia. We'll take a look at this report to give us more context of the story.
120 million people practice open defecation in West and Central Africa, and the region accounts for 24% of this practice globally. Open defecation has devastating consequences on health, on the dignity and protection of women and children, and the economy due to poor sanitation. However, in Namibia, open defecation became quite alarming. Over 1 million people lack proper access to toilet, leaving them with little choice but to defecate in the open, whether in urban outskirts or remote rural areas. According to data from the Joint Monitoring Program in 2020, compiled by the World Health Organization and UNICEF, Namibia has the 6th highest rate of open defecation in the world, standing at 47%. Less than half of the country's 2 million inhabitants have access to facilities that effectively separate human contact from waste, and merely 5% rely on inadequate options such as open pits, buckets, or hanging latrines. The consequences extend far beyond the unpleasant odor. Due to the substantial amount of human waste left behind, avoiding contact or ingestion is nearly impossible in Namibian households. Compared to other regions around the world, open defecation is more prevalent in sub-Saharan African countries, including Namibia, which lags behind other Southern African nations regarding sanitation coverage. These dire sanitation conditions compromise safety and dignity and hinder education. Insufficient menstrual hygiene management facilities at schools lead to increased absenteeism among girls. Moreover, Namibians are forced to seek seclusion in the wilderness, putting themselves at risk of sexual assault, robbery, and encounters with wildlife. Nevertheless, Namibia's own constitution emphasized the importance of consistent planning to elevate and sustain an acceptable level of nutrition, standard of living, and public health for its people. While the Namibian Prime Minister acknowledged in March 2023 that the government recognizes the need to improve universal access to sanitation and hygiene in rural areas and informal urban settlement, it is still premature to evaluate the effectiveness of this endeavor.
And that in-depth report was put together by members of the Center for Collaborative Investigative Journalism, and quite, if I may say so myself, an award-winning investigative piece,
Oh,
so
look
to
at
speak.
that.
That particular piece, I've come to see it on several platforms, and that's just to show you how far and wide that piece has gone. And joining us is one of the people who put together this particular investigative piece, is Federick Clayton. Freddie, thank you for joining us on the show today. Hello, Freddie, can you hear us?
Hi, yeah, I can hear you. Can you hear me?
Yes, we can hear you clearly. Thank you so much for joining us on the show.
Thanks for having me on.
Thank you. I'm going to go straight to the piece, first of all. Well, you know, going through that particular report, which I had read over and over again, and then each time I click on open defecation in Namibia, I get to see this report several times, meaning it actually has traveled far and wide. Now, I just want to ask, you know, and of course, the team that put this report together, kudos and well done to the team. I'd like to start by asking, how did the situation of open defecation become so bad in Namibia?
Yeah, so there's a few factors here, three mainly. The first one could be, we could say, historical factor, where Namibia is sort of playing a little bit of catch up. So independent in 1990, so and that's not too long ago. So in terms of infrastructure and the kind of infrastructure required for good sanitation levels, it's playing catch up, catch up from the colonial times, catch up when it was under South African rule as Southwest Africa. So there's certainly a historical element there. There's also a geographical element where Namibia is one of the most sparsely populated countries on Earth. You know, it's 2.5 times the size of Germany, but only 2.5 million people. So it really is extremely rural, sparsely populated place, which means that it's difficult to get the appropriate infrastructure out to people who live in the rural areas where half the people live. But there are other countries in the region of Southern Africa suffering from those two issues, both the historical injustices and the geographical restraints of a rural area. And so really we come into the third issue, which is the kind of political incentive to provide adequate sanitation to the people of Namibia. And that's an area, the third, maybe most key area, where since independence in those 33 years, it has been this kind of neglected sense. And Namibia has made incredible strides in water, providing water to its people. It's the driest country in Southern Africa, and yet a large proportion of their people do have access to water, and some great strides have been made there. But in terms of the sanitation sector, this has really been one of the more neglected areas where money has been spent, perhaps on the buildings, but not on the training, education, and maintenance required to kind of instigate behavioural change and bring safe sanitation to the country. So historical and geographical, yes, but political factors are certainly at play here in keeping this kind of human right from Namibians.
Right. I would also like for us to talk about, you know, you mentioned the issue of negligence, and a lot of people have blamed that on the government. And we'll just like to know what government agency is responsible for sanitation in Namibia, and what could possibly have been the reason for the neglect.
So one of the actual key findings of the investigation is that there is no department for sanitation or ministry for sanitation in Namibia. This is kind of one of the main issues. And this was an issue actually called to attention by the UN in 2012. When you don't have this dedicated ministry, what you end up is it's kind of everybody's responsibility and nobody's. So there are 8 ministries, and this is by Namibia's own hygiene and sanitation policy. There are 8 ministries tasked with the implementation of sanitation. So in that, the responsibility becomes incredibly diluted. You might have the Ministry of Transport responsible for getting the parts around and to do with the infrastructure, and then you've got the Ministry of Education is about sort of providing sanitation in schools, then the Ministry of Health providing the training, then the Ministry of Water getting the necessary water. So for this to kind of work, you really need every single 8 of these government ministries that are all sort of autonomous and independent working together, and they all have to decide to make sanitation a priority of theirs when they're all obviously dealing with other things. So this is one of the major issues, that when you have sanitation is not just an infrastructure project. You can't just put down toilets. It involves so much more than that in terms of bringing the communities on board, involvement, education on maintenance, on use, on proper use, whether that's dry sanitation without water or wet sanitation with water. So you can't just say, let's get let's put a few toilets down. So it does require this kind of collaborative effort. It does require it to be a priority and a focus. And whilst the Namibian government have spent millions, billions of Namibian dollars on infrastructure and toilet infrastructure, what they haven't done is spent the necessary money on the outreach required to instigate full behavioral change and to bring on especially and promote the use of dry toilets. In fact, one of the major issues I've found is that the Namibian government tends to promote the idea of this kind of one wet toilet for every household. That's one flush toilet. Now, if you have a country like Namibia where you have half the population living in these rural areas that may never be on the grid, and by on the grid I mean part of this sewage network, it's a difficult promise and I think an irresponsible promise to make, to say you're going to have a wet toilet, because really there is no downside to a dry toilet, except that they do require more maintenance. They're certainly not less safe. They're certainly not less hygienic, as long as they're taken care of properly. So it's that kind of promotion of wet toilets when it's not really a realistic possibility. It's the neglect of training and maintenance. It's the lack of collaboration. It's the lack of it being any one ministry's responsibility that has led to this kind of confused mess, which means the sector kind of sits on its own, neglected off in the corner. And of course, that comes at the expense of a human right and Namibians not having what they deserve, which is safe access to improved sanitation.
Now, I know that Namibia is not the only country that's having issues with open defecation, and like you clearly stated in that report, it largely is an issue that's affecting sub-Saharan Africa. Now, I also remember that in 2021, UNICEF had a program concerning, or that was affected, that was supposed to support Western Africa when it comes to open defecation. There was Nigeria and there was Ghana. And the point I'm trying to make here now is it was quite difficult covering certain areas. Nigeria is a big country, Ghana not so big, but covering these areas were quite difficult, and then they employed the services of certain young people who would help them do it, which now brings me to what I'm about to talk about. Now, certainly, it's not easy to put together such an investigative piece like you guys have put together. So please, I want you to tell us about the team now behind this entire piece and how long it took you guys to work together and to do this, and how difficult, what kind of challenges. I want to believe that there were a couple of challenges you must have faced, especially as you've explained, Namibia is sparsely populated and quite a big country. So what were the issues you all had while trying to put this together?
Yeah, so I would say actually we're kind of around about the anniversary of the kind of inception of this project. Maybe 13 months ago, we kind of kicked off with the statistic, which is that Namibia has the worst rates of open defecation in Southern Africa. So if you kind of start with that, we're all about finding out why. So to find out why, I mean, this was a collaborative project in every sense. I worked with Sonia Smith, leading Namibian journalist, and Margaret Courtney-Clark, an award-winning Namibian photographer. And it was really the three of us on the ground last November, essentially sort of traveling to these key parts of the country. We really wanted to capture, and this was one of the more difficult things, not just the issue of sanitation in the cities and the informal settlements. Again, this is a geographical issue that Namibia has, where there's a lot of rural to urban migration right now, and it's kind of making these really tightly packed informal settlements, which leads to poor sanitation. So we were kind of exploring our way through those, talking to as many people as possible, but then we also went to the rural areas, to the coast, used some of Margaret's historical reporting that she's done as a photographer in the region, and we kind of compiled this dossier of information that really encompassed as many parts of the country as we could, that between the three of us we had managed to get to. So that was difficult, and you know, long drives to each part of the country. You know, you're in areas that are potentially unsafe because they're unsanitary, because of the open defecation problem. So these were the challenges we're facing. But what wasn't a challenge was finding human accounts and the stories that are shocking, because everybody had one. When you speak to somebody in the rural areas or in the informal settlements, I was thinking, you know, and as a journalist, you go to these places and you sort of think, well, I'm going to talk to as many people as possible and see what kind of stories we get. This wasn't a challenge here because everybody had a story in terms of their relationship with sanitation and how they've been negatively impacted by poor sanitation. So there was so much to. People were also really keen to share these stories, and no one had really asked them about this stuff before. So me, Sonia, and Margaret as a trio kind of did this around the country on the ground, but then the process afterwards, because this was all happened last November and the story wasn't published till May. So those 6 months was a process of, the first 2 months was really about the Centre for Collaborative Investigative Journalism, as you've mentioned, compiling this information that we gathered across this month and working out how we could present this and how we could best hold government to account and how we could best present this information in a way that says, look, here are the statistics and there's evidence of neglect here, and hoping to instigate change in that way. So it was a long process. I mean, it was really a 9 months of work with 1 month in Namibia for the reporting itself, and then just writing, editing, rewrites, re-edits, working out what to do with the story.
Okay, finally, Frederick, this work has clearly traveled far and wide, and that is something of pride for journalists. But for us as journalists, it's not just about how far the work travels. It's more about the actions that are taken as a result of the reports that we have prepared. Now, that leads me to asking my question. Has there been any response to that report, or is there something you hope to achieve with the reports that you put together?
So we were really pleased that within a day of the second part of our story being published, the government, the Ministry of Water and Agriculture and Land Reform made a direct response, and they kind of, if there is a ministry that's supposed to take responsibility, it's them. They had a direct response. They made a series of promises that they outlined for 2023. Now, I'll be doing some further reporting in January to sort of see where we're at with those promises. But the real sign of improvement will come in the next UNICEF census, when we can see the results of that, to see if those numbers of open defecation have dropped, if the percentage of access to improved sanitation has gone up. We'll find all of that out when that next survey comes around, and we're all really hopeful that this will have made an impact in that way. In terms of tangible stuff on the ground, I actually received a message today from Aline van der Linden. She runs a private company that produces high quality dry toilets for schools, for example. And she said that on Tuesday this week, you had the Deputy Minister for Water, Agriculture and Land Reform in these schools doing a sort of a dry run of seeing how these dry toilets worked, watching their installation and showing more of an interest than they had shown before in the installation and of dry toilets as a solution. Namibia will not achieve full sanitation without the promotion and use of dry toilets. So this was a really promising step, actually, and hopefully a result of the pressure that we put on them to say, look, you need to start doing this extra work, because it's, like I've said before, it's not just an infrastructure project. You can't just put a toilet down. So we're encouraged to see those toilets go down this week. There have been other stories of toilets going down in other towns as well. And this is really all good stuff to see, but really we'll know if there's been true improvement when the next census results comes out. So we're eagerly anticipating those.
All right, Freddie Clayton, I would like to say well done to the entire team, and I would like to say thank you, because this is not just, I wouldn't just call this investigative journalism, I also like to call it solution journalism, and that largely is what the rest of Africa and the rest of the world entirely is looking towards. Once again, thank you to you and the entire team, and well done on the piece that you all have put together.
Thank you very much.
All right. Solution journalism, like I said,
clearly
the rest of Africa definitely does need journalists like Freddie and the rest of the team to tell the stories going around, just so that, you know, things can definitely improve. People who are guilty of not doing their jobs can be brought to book, and like I said, things can just definitely improve.
And I like that he mentioned that within the second phase of their report, the government actually reached out and said they take responsibility. If there's anybody that should be responsible for that, it's them. I think that governments across the world, across the continent especially, need to learn from that. Accountability is one thing that has been lacking in Africa for the longest time. People are trying to push faults, push blames, and push responsibilities to others. If only we can just do what we're supposed to do, and when we're called out, we should actually accept that it's our fault. So I did like that part of it, and it was a brilliant piece altogether. Definitely
it was. We're going on a quick break now. When we come back, we'll move away from the southern part of Africa to the western part, where we're talking governance, and we're looking at the role played by the judiciary when it comes to settling election matters. Do stay with us.